Why is TB different in immunocompromised people? Imagine a tiny bacteria causing a big health challenge. That bacteria is Mycobacterium tuberculosis, and it can cause tuberculosis. But in people with weakened immune systems, this bacteria behaves quite differently. Their immune defenses are not as strong, which changes how the disease develops and how it appears. This is why tuberculosis can be more serious and harder to diagnose in immunocompromised individuals. People with compromised immune systems include those living with HIV or AIDS, cancer patients, individuals with diabetes or chronic kidney disease, and those taking medications that suppress the immune system. Because their defenses are weakened, their bodies are less able to keep the bacteria in check. This means they are much more likely to develop active tuberculosis after being exposed. In fact, their risk can be 6 to 50 times higher than in healthy people. The bacteria can reactivate from a dormant state or cause a new infection because the immune system cannot contain it effectively. Another key difference is how the disease shows up. In healthy people, tuberculosis often causes a persistent cough, weight loss, night sweats, and fever. But in immunocompromised patients, symptoms can be less typical or more severe. They might have more intense respiratory problems, but their chest scans may not show the usual signs of tuberculosis. This can make diagnosis tricky, as doctors might mistake it for pneumonia or other lung infections. Because of these unusual signs, tuberculosis can sometimes be missed or diagnosed late. Diagnosing tuberculosis in these patients is also more challenging. Tests like the tuberculin skin test or blood tests that measure immune response depend on a functioning immune system. When the immune system is suppressed, these tests often give false negative results. This means a person with tuberculosis might appear to have no infection, which delays treatment and increases the risk of spreading or worsening the disease. The outcomes for immunocompromised people are often worse. Because of delayed diagnosis and atypical symptoms, they tend to develop more severe disease and have higher death rates from tuberculosis. For example, tuberculosis is a leading cause of death among people living with HIV. Their weakened immune defenses cannot fight the bacteria effectively, leading to faster disease progression. Treatment for tuberculosis generally follows the same guidelines regardless of immune status. However, in immunocompromised patients, doctors need to be especially careful. They must consider potential drug interactions, especially in people taking antiretroviral drugs or immunosuppressants. Monitoring is crucial to ensure the medications work well and to catch any side effects early. Preventing tuberculosis in these groups is also vital. Early detection and treatment of latent tuberculosis infection can stop it from becoming active, especially in transplant recipients or those starting immunosuppressive therapy. Many immunocompromised individuals develop tuberculosis from reactivation of a dormant infection rather than a new exposure. This is common in transplant patients, where immunosuppressive drugs are started to prevent organ rejection. In these cases, tuberculosis often appears within the first year after the transplant. In summary, tuberculosis behaves differently in people with weakened immune systems because their bodies are less able to contain or fight the bacteria. This leads to a higher chance of disease, atypical symptoms, diagnostic difficulties, and worse outcomes. Recognizing these differences helps healthcare providers diagnose and treat tuberculosis more effectively, improving the chances of recovery for these vulnerable populations. Always consult healthcare professionals for personalized advice and care.